Every year, almost 7,000 women find out they have ovarian cancer. For many, this is a death sentence because diagnosis comes too late to treat the disease effectively. The reason is that too few of us are aware of the early symptoms of a disease that is the 5th biggest cancer among females. So why are so many clued up women not spotting the signs of ovarian cancer? Symptoms of ovarian cancer are often wrongly diagnosed as irritable bowel syndrome, menopause, or simply being stressed or out of sorts. And it's easy to see why. To many women and their doctors, these symptoms are very similar to these common conditions. This means many women are unaware they have ovarian cancer, and life-saving treatment is being delayed. That is why Ovacome is today launching a campaign to spell out the telltale signs of ovarian cancer. We call it our Beat Ovarian Cancer campaign. B is for bloating, that is persistent and doesn't come and go. E is for eating less and feeling fuller. A is for abdominal pain. And T is for telling your GP. Treatment is becoming more effective every year. We want women and their GPs to be aware of these symptoms and to take them seriously as indicators of ovarian cancer. Detecting them quickly can be the difference between life and death. We're going to meet 2 women who've had ovarian cancer and have agreed to share with us some of their experiences about how they found out they had the disease. Lorraine, can you tell us how it all started?
In 2005, I had abdominal pains, persistent abdominal pains, which I wasn't happy about. And I'd lost my sister 18 months before to cancer, my youngest sister, and I was just a bit concerned that I should just have it checked out. So I went to my GP, and he actually referred me to a gastrologist, and the gastrologist said everything was fine. And I went away, and I didn't really think any more about it. There were no more symptoms, and I was fine. And I had a hectic, busy life. I felt healthy. So
you were assured that there was not really a problem?
Women of a certain age do get, extra weight, and it's put on around your middle. But it was just it was more than that, and I was just very uncomfortable with it. So eventually I went back to see my doctor. And I said, look, I'm really not very happy. This is not right. He actually gave me an examination. He said there were no masses. There was nothing there that was any untoward. It was probably the irritable bowel syndrome that he had diagnosed a year earlier. I'd actually lost my appetite as well. That was another of the symptoms, is that I couldn't eat. And that was not really like me. And I would only have a very, very small portion, and I would be full.
So it was an absolute classic symptoms, the bloating and the lack of appetite, plus just feeling full.
I was having supper with a friend of mine, and she said, had I thought that it could be gynecological? And I said, well, I have never had any problems, gynecological problems at all. I've got an appointment to have my 3-yearly cervical smear in a couple of weeks' time. I'll speak to the nurse about it, which is what I did. I went to see and had my cervical smear, which in fact was fine and all clear. But whilst I was there, I had a long chat with her about the symptoms that I had, and she knew that there was something wrong. She referred me to the lady doctor in the surgery, and the lady doctor immediately knew that there was something wrong, very wrong. Within a few days, I went to see the gynecologist, and it was confirmed. So that's when I had my diagnosis, and that was April 2006.
So if it hadn't been for that nurse, things might have been very different in terms of diagnosis.
Absolutely. The nurse, I owe her a lot, actually, because she listened to me, she listened to my symptoms, and she, in fact, wouldn't let me out of her surgery until I'd made an appointment to see the lady doctor, because she knew there was something more than just IBS.
So what was your experience, the first things that you remember about not feeling absolutely right?
I had extreme bloating. I had blood in my urine. I visited my GP, who just put it down to a urinary tract infection, and I went home with some antibiotics. 6 weeks later to be having similar symptoms. And as the year progressed, the symptoms became worse and worse each time.
Was it diagnosed immediately when you went to see the doctor?
It took probably 10 visits to my GP, and antibiotics were administered every time. A sort of year after the symptoms had started, we moved home to a new village, and I registered with my local GP, and he was phenomenal. And he said, well, I'll tell you what, we'll do a strong course of antibiotics, and if the symptoms reoccur, I'm sending you to a urologist because something must be wrong. No woman should ever have 2 urinary tract infections without seeing a urologist. He spent a lot of time listening to what my problems were. My stomach had become almost protruding, and it looked like I was pregnant. Really, really painful and just so uncomfortable. I actually stopped going to work.
Cancer was not something that you really thought was the problem?
I have no history of cancer in my family. I am just one odd person that, had the bad luck.
Do you feel that things would have been very different if you'd been diagnosed earlier?
I think if I'd had an earlier diagnosis, I think my fertility wouldn't have been a problem, which is part of the emotional battle that I've had to deal with.
What would you like to see happen in the future?
If anyone out there, regardless of what age you are, think that you have something wrong, challenge your GP. Keep going, and make sure you see the same GP every time you go, because they know your case. When you see a different GP each time you go, your case is kind of lost in translation. Be assertive, don't be pushy, but just be assertive. Say, this is what I have, and there must be something wrong. I knew there was something wrong with me. And if I had pursued that more aggressively at the time, I think perhaps I'd be sitting here pregnant.